Good morning or good afternoon, everybody. Welcome to my channel, Conversations with Rudy Rivera. Before we begin, I want to tell you to subscribe. Today, I am really thrilled to have Dr. Wojciech Szczeklik, who is a doctor in Poland, working with Doctors Without Borders and handling in Poland a number of the refugees coming in from the Ukraine. Doctor, welcome and thank you for agreeing to talk with me. Your work is so important to what you're doing right now. I understand that there's about 2 million refugees that have gone into Poland at this point.
Good morning, everybody. Good morning, Ruby. Great to be with you. Thank you.
Thank you.
Yes, it is a huge number of people coming recently to Poland, over 2 million now. So we are trying to cope with the crisis, the refugees crisis, for the last month, and it has been quite difficult times for us here.
And I mean, normally you're busy when there's not a crisis. So you have two crises, really. You have the war, and then you have all the people coming in that need medical treatment.
Yes, so just to let you know, I'm actually an intensivist. So I work on intensive care. You may call it critical care. So the last 2 years have been super busy for us with COVID. And just when we thought actually that we are trying to have a bit of a rest, the war came. And again, we had to increase the number of our beds. We had to increase number of doctors, so nurses and staffing across the whole country, actually, to accommodate the refugees. So just to give an example, is like without crisis, my intensive care is 11 bed. And with COVID, I had to increase it twice. And the same we are preparing now for the wounded person during the wounded soldiers or like people, casualties of the war. So we also increased the numbers of beds by 2 times.
Well, I'm familiar with Doctors Without Borders, but for those who are listening who aren't familiar with Doctors Without Borders, can you explain what the group does? Because I know they're all over the world.
So, Rudy, Doctors Without Borders is one of the organizations that help in many crises around the world, especially where you have where you have a lot of like refugees and health system crisis. So I'm actually cooperating with many of these charity foundations and healthcare foundations, and Doctors Without Borders is one of them. But there are a lot of organizations helping us here and helping in Ukraine. I'm meeting today with friends coming from US, from Children of War Foundation. So a lot of these foundations and organizations are helping us a lot.
It's become a global effort because this is the biggest refugee crisis, I think, since the war, in terms of displaced person, since the last war.
It's absolutely unbelievable. 2 months ago, it's like in less than a month, there were about 4 million refugees escaping from Ukraine, escaping from war. More than 2.2 million came to Poland already. So if you compare it, Rudy, to the crisis which we had a few years ago with the Syrian war, this was about 1 million of like refugees coming to Germany, but in a year time. Now we have 4 times the number and coming in less than a month. So it's a huge organization as well, like problem. How to help these people to accommodate outside their homes.
Well, so there were 1 million in Germany that came over a year, and here it's almost 2 million within months, right?
Just in Poland, yeah, just in Poland, and 2 more in the other neighboring countries to Ukraine, yeah.
So, I mean, you said that you were a critical care doctor. What are the things that you're seeing the most with the refugees that come in? I mean, I imagine they're scared, they're tired, fatigued, in some cases, not enough food. What do you see there?
So, Rudy, for critical care, it's not yet so disastrous yet. So, I work in a military hospital in Krakow, which is second largest city in Poland, and actually, I would say one of the largest cities close to the Ukrainian border. So, we were appointed to be a main hospital as to accommodate all the casualties of the war. However, the Russians do not allow the humanitarian tunnels, do not allow the humanitarian transport. So there are only few actually casualties of the war, wounded or like whatever, like like bombs or whatever happened that came to our hospital already. These are like few cases only, because we are not allowed to transport them from Ukraine to Poland. So we are waiting for this war casualties, and we think they might start coming in a week from now, as the negotiations with Ukrainian Russians are on the way. What we've been seeing is that we see a lot of exacerbations of chronic diseases. So these people, as you said, are like enormously tired, exhausted, dehydrated, super stressed, and of course all these things they often like run away, escape without their medication. So we're seeing a lot of exacerbation of chronic disease, and quite many, unfortunately, cardiac arrests and sudden deaths that are treated on intensive care. So yeah, these are the cases we see, and in the same time there are much more cases in the primary care, in the emergency department, and outpatients clinics. So these are patients that are really, really huge numbers of refugees coming to these places.
I noticed when I interviewed a young lady, a mother who, her child was in Poland and needed to get to him and was worried about getting out. So the stress that she has is incredible, not knowing where your child is. But I think you multiply that in addition to not knowing when you're going to be safe, if you're going to be safe, and not knowing where your relatives are, whether they're alive, they're okay in the Ukraine, because the only people that I understand are allowed to leave are women, children, people above a certain age, but the able-bodied men have to stay there, and they are staying there. They're not running. I mean, that's it's very impressive character trait of the Ukrainian men.
That's impressive. It's like really, what I've seen from the statistics is actually over 90% of refugees these are women and kids. So it's actually, we hardly see any men. All of them stay and fight. There are some Ukrainians that used to be in Poland before the war. It used to be a strong community of about like 1.5 million. Poland is 38 million, so it's a large community. So they often like even go to Ukraine back to fight for the land. So it's mostly women and children, as you said.
And there are also many Polish Ukrainians living outside of Ukraine who are going back to fight. I know of one individual who lived in St. Louis. He did a number of adoptions for Ukrainian children to American families, and he was shot by a Chechen sniper coming out of a bunker. So it's just terrible. You said that there's some exacerbation or of existing conditions. What are some of the other conditions that you're seeing with the refugees coming through?
Yes, so as we discussed, most of them are actually always like diseases of like traveling in a long and unbelievably bad conditions. So dehydrated people, people in a huge stress, people without the medication. So a lot of like heart problems when you stop the medication for heart, or like chronic chest disease problems. But what we're seeing also is on the beginning of the war, the first refugees were actually all the ill people, sick people, chronically sick people. So there are a lot of kids treated in Polish hospitals with leukemias, cancers, diseases of respiratory diseases which are chronic. So Krakow is actually filled with patients with cancer, kids cancer. Yeah.
Well, you also have things like diabetes. You have other situations where other diseases where you need your medication, or it can be devastating. So you got heart medication. People maybe have kidney problems, need their medication, and even people, for example, who need dialysis or people who need chemo. Those things are really put them in a really tough spot.
All the cases you mentioned, I've already seen in several numbers on the emergency department here in the hospital. So it's true. Last night, I seen a patient with diabetes uncontrolled due to lack of medication. So this lady traveled for more than 24 hours without her medications, and actually she was almost unconscious when brought to the emergency department. So all these things you mentioned, all these diseases, we see them here a lot.
You know, Wojciech, I am just so amazed and so, I mean, thrilled how the Polish government and the Polish people have stepped up to helping their neighbors. I mean, this is incredible. Honestly, I have never seen that type of cooperation from a country in other types of crisis.
I must say, Rudy, it's like I was so impressed, mostly with ordinary people. So it's like we have these polls which say like, would you help like the Ukrainians? And they say like more than 90% I would help them personally, and I actually did. And I think it's really true, because it's like when you look at like enormous amount of people being admitted to our houses, people going on street with baskets of foods, with clothes, and actually caring for the refugees. It's really heartbreaking, and seeing these Ukrainians, but in a way also like the amount of help they're getting. So it's incredible. And you can really see it as well, actually, coming from outside Poland, which is also very, very like impressive. Yeah.
And also, I've seen on TV where one Polish family took in about 40 refugees, not at one time, but took 40, one family at a time. And Polish mothers are leaving their baby carts by the train station, so Ukrainian mothers can have them with their kids. I mean, the generosity is just unbelievable.
Again, so you've probably seen a lot of these pictures from, again, the Syrian crisis. It's like usually this to be some sort of camps for the people. You try to get them in one place in large spaces and accommodate them there. So the difference here is like, of course, we have these shelters, but most of the people are actually accepted to families. So they're accepted to regular people, like sharing the flats, sharing the houses, and caring for each other. So this is extremely impressive, and it's like and it's mostly done by ordinary people. Of course, there's a support from government, but when it started, it's like it was only and truly like help from the heart of the citizens, which was very moving. Yeah.
And I've seen no evidence of any pushback at all.
No,
Too many. And so like in Germany, some Germans complained about the refugees. We've got too many of them with the Syrian crisis. But I've not seen anybody, at least on any news channel, that has complained about the number of Ukrainian refugees going into Poland.
No, I would say it's probably both difficult to get out of Ukraine, because it's the border on their side is it's quite regularly and tough checked in terms of like men not leaving the borders. But we didn't have any pushbacks, and some of us were worried, because you probably are aware of this Belarusian crisis we had some few months ago.
Yes.
And as we know for sure now, this was a huge provocation from Belarus and Russia. Like, vans bringing the refugees to our borders and trying to get them through our border. And this was like somehow to destabilize our country and destabilize the borders. And actually, we've been seeing then a lot of pushbacks, and we had this negotiation, we had this like discussions. The government had this discussion with EU. What should we do? And actually, the decision was that it's a provocation, and that we should not let in this refugees then. But now the situation is absolutely different, 100%, and none of the pushbacks have been seen here. No.
Well, could you explain to our listeners what that situation was with Belarus and forcing people into Poland? Can you explain that to us?
Yes, so I think it was about 3 months ago, Rudy, when we have a situation on our border with Belarus, which was a situation that people were like forcing to enter European Union through Poland and trying to get through our borders from Belarus. So these were mostly refugees from Iraq, Syria, and from Far East, brought actually with planes from their countries like to Belarus, to Russia, and driven to the borders of Poland. And of course, a lot of these people were refugees that I'm pretty sure should enter our country. But this was such huge numbers, and we had like no way to actually evaluate the people who want to enter the country. But there were a lot of pushbacks on the border of Belarus and Poland, and this was quite loud in the news, because the scenes that you could see was like not these people wanting to enter Poland and not being allowed to do so. And we already knew then, or we suspected then, that a lot of this were happening through like sort of provocation of the Belarus government. And now, seeing what's happened like in Ukraine, most of us are pretty sure this was a provocation to destabilize our borders before the war.
I remember reading about that. That was really an attempt to destabilize the Polish economy, and not really a humanitarian effort to save people. It was just, let's throw these people in. And of course, we all know the status of Belarus at this point. I mean, they may as well be part of the Soviet Union at this point. But and I know, Wojciech, you're not a psychiatrist or psychologist, but are you able to comment on what you see from an emotional point of view with these people, from a psychological point of view? I mean, what do you see in their faces?
It's like, really, this is a very important question. I'm not a psychiatrist, not psychologist, but this is a huge problem and a burden for us, because it's like having these discussions with regular people on the street, but even more having these discussions with families and patients here in hospital. It's such a great tragedy. Very often, very deep grief on what's happening. A lot of like weariness about the relatives, the husbands, the fathers, brothers that stayed in the country. And actually, many of the families I had the opportunity to talk with in hospital. These are people that already had a lot of tragedies, including death, during this war. So they're grieving. They are like in very bad like psychological condition, and this is definitely a great burden for us as well. We have in hospitals a lot of friends from Ukraine that already been here before the war, so they help us in communication, and what helps us definitely is that Ukrainian is a Slavian language as Polish is. So if we speak slowly to each other, we can understand at least the simple words, or like have the simple communication. Also, most of the Ukrainians speak Russian, and as Poland being a communistic country, many years ago, fortunately, I was actually the last year that I had the obligatory Russian in school. So I still can understand and communicate in Russian, which makes it easier. But a lot of like psychological stress, a lot of like difficult talks that we have every day.
And that's very hard to treat. I've always said if you see a broken leg, you know to put a cast, you know the bone is broken, you can see where the damage is. But it's hard to look in somebody's head and see all the trauma. And especially when you have to treat them in a quick amount of time, because it's not just treating them, it's getting them stabilized, getting them someplace where they feel safe, because that's probably 50% of the trauma is not feeling safe.
Mm-hmm.
I mean, even being in a country as friendly as Poland, there's still the stress of where am I going to go? What am I going to do? How am I going to feed my family? And thank God for the kindness of the Polish people, because people are eating, people, have places to stay, and in private homes for that matter.
Enormous stress, Rudy, enormous stress. So it's like you leave everything behind and you have actually no place to go, no purpose, no plan, no work, no relatives, no family. It's enormous stress, and you can also see that it influences the health of these people, and actually is also a problem of the hospital as well. Like as I said, like this psychological communication, we have a lot of this during the last few weeks.
And those psychological issues also exaggerate physical problems too, from
Sure.
any current diseases that they have. And
yeah.
how can people help? If somebody wanted to help where you're at, what can they do? I mean, there are a number of people donating. There are a number of people that set up GoFundMe pages. But what are the things that you need most of?
So, Rudy, it's absolutely enormous what you see. How many people from all around the world actually help. It's absolutely amazing. And as you said, there are a lot of like charity foundations, a lot of like organizations that we mentioned some during this talk that help a lot. And I think this should be at this stage somehow more coordinated help. So a lot of these organizations are actually either going through Poland or contacting Ukraine directly, and actually asking what is needed before this supply. So it's like and definitely on Ukraine as well. There's no need for I would say blinded help. Like let's send everything we have.
Yes.
Should somehow try to get into what they need, and I mentioned this Children of War Foundation, which I'm actually meeting with them today. So they are coming with a great help for like one of the hospitals in Kiev. They will actually go then in 2 days from now. So what we did is I communicated with the hospital in Kiev and communicated it with them later on. And this is a directed help. They send us a list of things that they need. They need a lot of like medications, a lot of like one care, or like just like like regular things for regular hospital daily things. And actually this was like done on purpose and as specified by the Ukrainian side. So I think more like targeted help would be better now. Yeah.
Are there coordination efforts with the Polish embassies outside of Poland? You think that could be a vehicle where people could coordinate? Because, for example, Wojciech, I was in Mexico. I go to Mexico quite a bit. And one Sunday morning, there were Ukrainians, Mexicans of Ukrainian descent, protesting, going to the Russian embassy and protesting. They've interviewed the Polish ambassador in Mexico. So I'm wondering if that would be a good vehicle with which to coordinate all the assistance.
I think embassies, like you probably get this information. All these large institutions as as Doctors on the Borders, Caritas, whatever it is. These are usually organizations that, but by this time, by 1 month of the war, they already reorganized themselves to be more like, connected between each other, or like somehow like working in a group that they, in a way, like like it's not like random help anymore. So I think large organizations and embassies, it's definitely a good thing. Hospitals is another charity place where mostly like this money or like or supplies would be used in a good way. And I know that that a lot of organizations are actually helping here on spot in Poland already. So there are two ways you could do it. So one is like helping in Ukraine, and this is both like the military help, which I get a lot from US as well, but also the all the humanitarian help and health care, which I get like in Ukraine. And the other possibility is like they support the help here on the border of Poland and Ukraine or other countries.
Well, I don't want to end this interview, Wojciech, without talking about your credentials, because they are very impressive. Where did you went to medical school in Poland? Where did you go to medical school?
I did go to Poland, in Krakow, Jagiellonian University. So I finished med school here. And then traveled. So it's like I've been to other universities. I worked in Cambridge, London, in Harvard for some time, and I'm affiliated as well with a Canadian university, McMaster, in Hamilton. So quite a lot of traveling, but always connected to Krakow and Poland, always returning.
Well, I think you're being bashful, because you're also probably the youngest professor of a medical school in Poland.
Really?
One of the youngest
It's many years ago, and it's not true anymore.
Well, we all get old, right? I mean, we can't avoid it. I mean, we're all born with a terminal disease, and that is, at some point, we're going to leave this world, right? That's when we say we're terminal, because we're not going to be here forever. But I think the work you're doing is incredible. I think I'm glad to with the Polish, happy for what the Polish people are doing and everyone else in the world is doing. I think one of the key differences between what's happening now and what's happened years ago is that there are so many cell phones with cameras and videos that are showing the tragedy. World War II, all you see was a newsreel, but nobody saw, unless you knew somebody whose son was killed in the war, you didn't see the tragedy of the war. But here you're seeing the human tragedy, the human cost every single day, with individual families, with you see the bombing, and you just think, oh my God, Putin, what are you thinking?
And this enormous cruelty is like like bombing regular houses, or like bombing healthcare facilities. It's like unbelievable and absolutely you can't explain it with anything.
Even putting letters in Russian that their children hear, it doesn't prevent the Russians from bombing. That's what I find incredible. Let me ask you this quickly, because there are so many people who speculate on Putin's mental state. He's separated from the table, that he is unhinged. Honestly, I don't know what to think about that.
Have you seen this table, like 8-meter table, and this discussion he's having? Oh my God, it's like definitely hard mental problems, but speculations are also about his chronic conditions, that might like exacerbated recently, starting with Parkinson's disease or cancers. Nobody knows. So what we can see as doctors, his face has changed in the last few months, and it's hard to say what kind of disease could cause it, but I don't think any one of us think he's like in a stable mental condition. He can't be.
Well, you know that he's been stripped of all his judo honors. A number of us wrote to, because I'm a black belt in judo, a number of us wrote to these judo federations, said strip him because that's not the judo way. That's not, judo means gentle way. And so son of a gun, they stripped him.
Didn't know it.
Yeah. So I think it's a great thing that you're doing. Thank you so much for taking the time. And I would say, everyone, if you please subscribe to my channel. Wojciech, when I upload this thing, I'm going to have a link to where you're at in case people want to donate. However they coordinate that, I will tell them, do not just send stuff. Ask to see what you need, right? And see how we can help. One thing I can tell you, Wojciech, from the outside, everyone I know is angry. And I'm not Ukrainian, I'm Hispanic, but we're just also angry because we see the cruelty. There's a great expression from Man of La Mancha, cruelty beyond belief. To hear all the voices of God's noblest creatures, you hear the moans and bundles of filth in the street, you see comrades fall, you see them die in battle, you see the worst of the worst here, and I keep hoping that a Quixote comes out. A number of Don Quixotes come out, to slay the dragons, and the biggest dragon is who knows where he is because he's hiding his location. But that's horrible. Thank you so much, my friend. Good luck. I look forward to meeting you in person.
Rudy, thanks a lot for having me. And in the same time, I would like to say just huge thank you to all of you guys, like on the other side of Atlantic, helping us and from the beginning of the crisis, and actually all around the world. We really feel it, and what is more important, the Ukrainians feel it. So thank you a lot. Yeah.
We're going to keep up the fight. Okay. We will do whatever we can at our end. Thank you, Wojciech. It's so good to talk to you. Bye-bye.
Thank you.
Don't forget, you are watching Conversations with Rudy Rivera.